primary care and mental health integration kind of style of intervention is it's rarely 50 minutes. And you rarely get more than a few touches with the person. Like you might see them once or 2 times or 3 times. And so how do you distill ACT to its essence in those kinds of settings?
I'm not sure how I would answer that. I think that the way that I approach, therapy in general, and maybe it's because so much of it that I've done in the past, 10 or 12 years has been in the primary care office. But, I think that what I do as a therapist is I really work on trying to be present and open and curious and not sort of thinking ahead about, like, for example, if somebody says, we've got a client in room 3 who's depressed, and I start to sort of say, okay, here's what I do with depressed clients. I think what I really want to do is I want to go in and just be curious. And I think what usually happens is that the client will give you something to work with. And so depending on, what that turns out to be, sometimes it's just one of the points on the hexaflex. And you just say, oh, okay, well, so that's what they're giving me today. So that's what we'll work on with the next, let's say 20 minutes or 30 minutes, whatever amount of time we have. And plus, I think that there's some things that, I don't know if we should call them technologies, but things that some of our colleagues have come up with that are really helpful. Like I think, for example, the concept of moving toward or away is a really sort of convenient shorthand that applies to almost everybody, because we all as human beings do a lot of away moves without being sort of mindfully aware of what the function of that away move is. And so I feel like you can have a conversation with almost anybody, whether they're specifically looking for relief of suffering or whether they're just working in a company, and but it's really helpful to help them learn how to pay attention to that and sort of sort to use that terminology, like, what does this behavior fit into? What's the function of it?
Well, I think it's so interesting because it's just a really simple turn of phrase. Is it toward or away, that you could like introduce very early in a conversation, talk for 20 minutes about it. And then someone walks out with this little nugget of a way of looking at their experience in a new way and something to ask themselves.
Right.
I think that's, both the Choice Point and the Matrix have offered us that language in a way that's kind of lovely. When I did brief interventions, I think I did pretty much the same thing, but I thought of it just a little bit differently. So when I was in the college counseling world, we had walk-in hours across campus that we called informal consultation, as a way to reach people who wouldn't normally go to the counseling center. And about 30% of those folks were referred to the counseling center, but about 70% of them just got that brief intervention. Our average was about 1.5 visits per student. And we, just like in the primary care mental health world, we would kind of abandon like a really extensive assessment. We would just work with whatever came through the door. And we'd even let people be anonymous if we needed to. And what I would think was, like, just like you were saying, they're going to give you something that kind of falls somewhere on the hexaflex. I would think, where is their inflexibility here in this conversation? And then how can I like make one small intervention that's going to like help to shift them from inflexibility to a little bit more flexibility in the limited time that I have. And so basically, I would often look for like, what was one bit of story, about them or about the world that was kind of influencing their behavior in a destructive way or kind of just a negative way? Or what are they trying to stay away from in terms of feelings in whatever situation that they're in? Because you can find experiential avoidance in almost every situation. And then kind of offer them something small like toward or away, or I might do something a little experiential, actually, like, thoughts on cards, or, with those exercises in ACT where you push against your hand to like see what it's like to struggle versus just to have it. And then say, what would you do differently if you took this perspective? the next time you're in this situation with your roommate, or when you're lying in bed not wanting to get up, or feeling anxious about studying and wanting to procrastinate. And I found that, like, I was really surprised. I was kind of a devotee to the idea of, like, everyone needs like a good chunk of therapy, and that you need like 50 minutes to like at least get something meaningful there. But I was surprised at how many times someone came back a second time and said, wow, that was really helpful, or sent me an email later and said that made a difference, in a way that I kind of undersold the possible impact of it.
Yeah, well, I think it's really interesting to think about, you know, college counseling, and again, the way that population is unique, and sort of thinking about, like, what are they expecting when they come in, and how does that change what they're open to, or what you can do with them. And, you know, I mean, everybody I think knows about that. There's some research that I've heard that says the average or the modal number of therapy sessions is 1.
Yeah.
And so, but I think I was at a pre-conference workshop with Kirk Stroessel and Patty Robinson, I think is where I heard this, and where they basically said, or promoted the idea that that you should, or we should, particularly in primary care, but I can see how it would work in college counseling, and maybe in anything that you do, in anywhere that you're doing therapy, is to approach this meeting with the client as if it's the only meeting that you're going to have. And so while you may have other meetings with them, and, you know, hopefully you can add more with that, but if you take every meeting with a client like it's the only one that you'll ever have, then you'll make sure that you're giving them something that they can travel with, that's portable, that they will be able to use. But it,
Turn of phrase, giving them something they can travel with that's portable. I mean,
yeah.
hopefully that's what we're doing in psychotherapy, that we are, whether explicitly or implicitly, just through the process and them experiencing something, they can carry something with them that's going to make a difference in the rest of their life.
Well, when you do an exercise or a metaphor or something with a client or with a colleague or something like that, you can tell that for some people, like, it really makes sense, because then they'll come back to you and tell you that they told like 5 other people and they practiced it with them. So I think that it's, you get a good sense of what's meaningful and what works.